Hi, my name is Annie Bryant, and I'm a third-year PhD candidate in the School of Physics. My research project is investigating data-driven analysis of changes to resting state brain dynamics across different disorders, from Alzheimer's disease to schizophrenia to autism spectrum disorder. And I will be submitting my thesis in June 2025. My background is in behavioral neuroscience, which I studied at Northeastern University in Boston. And in Boston, I worked for several years as a research technician in an experimental Alzheimer's disease lab, working with Dr. Rachel Bennett at Massachusetts General Hospital, Harvard Medical School. And there we integrated techniques from transcriptomics and multimodal neuroimaging to study interactions between tau pathology and vascular dysfunction in Alzheimer's disease. So in my research, I work with different tools for highly comparative time series analysis. And it's a really interesting lens through which we can view and quantify different types of brain activity with different types of multimodal neuroimaging. So I mostly work with resting state fMRI, but I'm kind of branching out also into PET and diffusion imaging to get a better sense of, over time, what's happening to the brain in different disorders. Again, my background is Alzheimer's disease. That's my primary interest, but I'm also expanding my horizons in my PhD. So I really hope to integrate changes to resting state brain dynamics with different molecular changes, like the accumulation of tau and amyloid in the brain in Alzheimer's disease. And I think we're kind of taking a unique approach that blends physics, engineering, medicine, and psychiatry all into one big smorgasbord of a project. And I very much hope to continue in that line for my postdoc. So I joined the Sydney Clinical Imaging Network to stay really interconnected with the researchers and clinicians at the forefront of translational imaging and having a better understanding of the more basic science work that I do. What are the most pressing needs in the clinic? The research group that I was part of previously had a really great intersection in that space, and I was thrilled to be able to join a similar intersection here in Sydney. And I'm really excited to continue engaging with researchers and clinicians to make sure that I'm, keeping my eyes on the prize of what are the most pressing issues, specifically in dementia, but also more broadly in brain health in general. So in one of the final projects for my thesis, which I'm really excited about, we'll be looking at the spatial relationship between resting state brain activity changes and the accumulation of tau and amyloid at the level of individual brain regions. In the data set is called A4. It was a clinical trial of all cognitively normal participants with varying levels of amyloid. That's now been openly shared, over 1,000 participants from the US. And we'll be applying highly comparative time series analysis to compare how the accumulation of neuropathological proteins in Alzheimer's actually relates to localized changes in brain activity in cognitively normal individuals, with the hope of better understanding how these proteins that we know are deleterious are actually related to localized changes to brain activity. So for my EMCR presentation, I'm excited to share work that's formed the bulk of my PhD research, where we've been kind of taking a step back and thinking about what's the best way to quantify dynamical structure in resting state brain activity. Usually researchers, if they have a resting state fMRI scan, they'll go straight to computing functional connectivity using a Pearson correlation coefficient, which is a very valid method, but only one of a myriad other ways to quantify localized and pairwise types of interactions in the brain. So we take a very data-driven and comprehensive approach to looking at different types of activity in the brain across different neuropsychiatric disorders.